Thanks for joining us for Season 6 of the ACED podcast. ACED is brought to you via the Justice Community Opioid Innovation Network, or JCOIN, with funding from the National Institute on Drug Abuse. I'm Danielle Rudes, your host, coming to you from Sam Houston State University in Texas and bringing you amazing science from today's top scholars and researchers in easy-to-understand language. The theme of Season 6 is diversity, equity, and inclusivity within the justice and health research field. I can't wait to share this season with you. Thanks for listening. Now, let's get started. If you've learned anything listening to me talk in all the seasons of the ACED podcast, it is now not a surprise to you that substance use disorders are a serious concern with many consequences. One type of SUD, as you probably know from listening to me, is opioid use disorder. The gold standard for treatment of OUD is medications, and the overdose crisis in the United States pushes the need for improved access to these medications. In case you're a numbers person, to show you how important the need for OUD treatment is, there were over 100,000, let me say it again, please, 100,000 overdose deaths in the United States in 2021 alone. But we don't only need to push for access to OUD treatment. There are some groups of people who have been largely absent from the scientific studies focusing on substance use disorder. One of these groups is people with disabilities. The literature that has focused on people with disabilities is enough so far to show the heightened risk for substance misuse among them, but what we know is still in its infancy. There are concerns about the accessibility to substance use treatment and how to make these treatments accommodate people with specific needs, especially people with disabilities. People with disabilities can face the same barriers as others in trying to access substance use disorder treatment, but in addition, they may also face stigma and discrimination that is often associated with their disabilities. Looking at the relationship between disability and substance use disorder, though, can help to develop culturally relevant, accessible, and inclusive prevention and intervention efforts. These efforts need to be developed to help end disability-related disparities in substance use disorder treatment and research. The efforts will also help improve access to the quality of substance use disorder treatment for people with disabilities. Some researchers have begun to look at the informational gaps regarding people with disabilities. The National Institute on Disability, Independent Living, and Rehabilitation Research, or NIDILRR, is one of those groups, and they funded the Research on Opioid Misuse, Addiction, and Disability Services, also called INROADS, to do so. One study from that project comes from Reif and the Institute of Behavioral Health at Brandeis University, and Monica Mitra from Laurie Institute for Disability Policy, also at Brandeis. They summarize the information that came out of that funding project, giving us one place to see the base of knowledge that was expanded regarding SUD and people with disabilities. The knowledge that came out of this initiative had a few themes. First, there was a prevalence of substance use and treatment among people with disabilities. The articles in this group used survey, healthcare claims, and administrative data. These articles helped to build a better base of knowledge for us. They saw that people with sensory disabilities had an increased likelihood of lifetime drug use. Even though they were more likely to have lifetime drug use, they weren't any more likely to receive treatment. Interesting. In this same theme, youth with disabilities and with parents who listened to them were less likely to start using alcohol at a young age. Importantly, though, the findings demonstrated how valuable it is to have an understanding of protective factors that reduce the risk of substance use disorder for people with disabilities. Protective factors are things in your life that protect you or keep you generally safer or better off. Continuing with the discussion of that first theme, one of the researchers looked at opioid prescription for chronic pain among pregnant individuals with different disabilities. This study saw that pregnant people with physical, inflammatory, or psychiatric disabilities were prescribed more opioids and they were given higher doses than self-identified women who were not disabled. Other researchers looked at the prevalence of SUD in people who are autistic or have an intellectual disability. Interestingly, this study found that over 5 years, the prevalence of SUD increased more rapidly among autistic people. There is importance in focusing on SUD in all types of disabilities, which has been demonstrated already, and that isn't even all the studies included in this article. The last piece of the first theme focused on substance use among adults with disabilities in the specific context of co-occurring conditions and chronic pain. The researchers found that people who had a disability were less likely to be currently using alcohol, but at the same time were more likely to have drug use, prescription drug misuse, and nicotine use. The chronic pain of the people in this study played a big role in the identified substance use findings. Moving on, we go to the second theme of the studies from the funding, focused on the experiences of people with disabilities and their providers. The first study for theme 2 that the authors discussed was done using interviews and focus groups with people with disabilities. The researchers in that study saw people with disabilities had many barriers to treatment that were related to their disability, like stigma. The next study looked at opioid prescriptions and the experience of people with chronic pain from arthritis and their providers related to those prescriptions. What were the people with arthritis and their providers saying? Well, I'm glad you asked. They were frustrated with new barriers to prescribing them that came from states and insurers. This was especially true when the opioids they had been using had been being used safely for years already. Finally, we get to the third theme in the present studies. This theme had a focus on the needed adaptations to measures of substance use problems and interventions to treat people so that the needs of people with disabilities were met. The first study in this theme adapted an instrument that was designed to measure opioid misuse for people with chronic pain and long-term opioid use. The instrument was adapted to make sure it was valid for people with disabilities and arthritis. I'm sure this will come as no surprise, but some of those measures in the original instrument could be harmful to people who have disabilities and had arthritis. The adapted measure, however, was valid for screening and monitoring harmful opioid use for this population. Another study in this theme focused on how to address the concern that cognitive impairment can impact engagement with and outcomes of SUD treatment. People with cognitive impairment were 5 times more likely to complete their treatment when the treatment had an accessible design and person-centered care. Overall, these studies are a great start to getting the information needed about SUD among people with disabilities. There are a lot of differences across disabilities, of course, and it is important that we understand those differences. We need to focus on the unique needs that people with disabilities have. We also need to focus on the interventions that are accessible and accommodate those needs to make any and all treatment approaches person-centered. The studies that Reif and Mitra summarized show that it is feasible to use a disability rights focus. Not only is this focus feasible, but it is also essential to addressing the substance use issues among people with disabilities. If all people are suffering, we should show care and concern for all people by learning as much as we can about their needs and doing everything within our power to meet or maybe even exceed those needs. Thanks for tuning in to Aced It, where we translate science into sense. You can find Aced It anywhere you listen to podcasts and check out our other offerings on JTech. That's www.jcoinctc.org/JTech. That's JTEC. We consider it our mission to help everyone learn. On JTech, you'll find e-learning courses, webinars, and other trainings, all geared to help you learn about justice and health research and research methods quickly and easily. Special shout out here to George Mason University, home of the Coordination and Translation Center for JCOIN, Sam Houston State University, and National Institute on Drug Abuse, and the National Institute of Health. Also, if you'd like us to break down some research that you've read or produced in a future episode of the podcast, send it to me at drudes, RUDES, @shsu.edu. See you next time on ACED It.